Hello, and welcome to our spotlight on COVID-19 and mental health. As I'm sure we're all aware, 2020 was a difficult year for everyone. Following an outbreak of the deadly COVID-19 virus, much of the world was forced into lockdown in an effort to save lives. However, this has had a marked impact on the mental health and well-being of many. So although there have been many different groups of people affected by COVID, we would like to try and highlight a few. So first of all, looking at students who might experience an increase in feelings of anxiety and depression. We might also see an increase in extension requests and also increased feelings of isolation. Students may also have concerns around money, anxiety around their studies, they might be putting themselves or their self-care last, and they also might experience online fatigue. Students might also feel like they're missing out on gaining that entire student experience, or they might be focusing on other things such as being a carer or being a parent, and Chinese students from overseas may face an increase in stigmatisation. Another group we'd like to highlight are people with prior illness, and they might have concerns of burdening the NHS with non-COVID related issues. They might face disruptions to their treatment, and they might also be missing that face-to-face contact and that therapeutic relationship. This could lead to increased risk of isolation, which could increase feelings of anxiety and depression, and could also leave perceptions of insufficient services available to support their mental health. Nurses and frontline workers are also facing a lot of challenges, such as long hours, risk of infection, lack of PPE, and loneliness. Physical fatigue, separation from their families, increased levels of anxiety and depression, but they also might experience increased levels of resilience. And finally, people who have experienced COVID might face an increase in stigmatisation. They might feel like their identity is defined by COVID. They might have worries about infecting others, and they also might have increased feelings of isolation. Now we're going to summarise the different types of mental health difficulties that have been experienced during the pandemic. Firstly, there has been a general increase in levels of anxiety. This includes health anxiety and concerns about getting infected or infecting others with COVID-19. Research suggests that this health anxiety is making people either repeatedly seek medical help or conversely avoid healthcare even when genuinely ill. For many, anxiety is focusing on worries around finances and job security. We have also seen increases in depression, PTSD symptoms, and other issues, such as loneliness and social isolation. The pandemic has been especially traumatising for frontline workers, such as nurses, who are really showing an increase in PTSD.